Okay, a lot of you saw my video about the CBC complete blood count interpretation and how to interpret different types of anemia. That was me basically explaining the different markers and what they mean. But a lot of you also put your labs in the comments, which is great. Thank you for doing that. I can't do individualized interpretation on labs, so I'm going to make a chart here and hopefully this helps. And if you don't know me, I'm Dr. Joyce Knieff. I'm a naturopathic doctor. I see a lot of complex chronic stuff in my clinic, and I like to take a really close look at labs. Okay, so real quick again, MCV stands for mean corpuscular volume. This is how big or small your red blood cells are. MCH stands for mean corpuscular hemoglobin. This is how much hemoglobin is in your red blood cells. Mean corpuscular hemoglobin concentration is the concentration of hemoglobin in each red blood cell. RBC is how many red blood cells you have, and RDW is red blood cell distribution width. I'm going to skip on hemoglobin and hematocrit for right now because mostly those just tell you how severe the anemia is. Okay, so if we start with the most classic pattern, if your MCV is low, your MCH is low, your MCHC is low, your RBC is low, and your RDW maybe might be high or normal. This is classic, I cannot write, this is iron deficiency anemia. This is classic iron deficiency anemia. I'm going to have to do cuts in this because I can't write through my camera here. Yeah, so if everything is low or borderline low and the RDW is getting up there, this is iron deficiency anemia. Your red blood cells might still be normal if you're approaching iron deficiency anemia, but not quite there. But in general, a picture of like everything being low, especially these three things, this is going to indicate more iron deficiency. And this is compared to if your MCV is high, your MCH might also be high. This might also be normal. MCHC being a little bit lower. So if you have big pale cells, again, RBC may or may not be normal if you're on your way to this type of anemia. This is more of a classic B12 folate deficiency anemia. And then you have the funky case that I was talking before in my previous video where if everything looks normal, but then the RBC is down, but the distribution width is weird where the cells look big, small, big, small, big, small. This can be a mix of iron deficiency and B12 anemia. Basically, you've got a mix of small and big, so it averages out to kind of look normal, but we're not looking we're not looking uniform here. And again, if you're not quite anemic yet, this RBC, this can be normal too, and if you just have an RDW that's elevated, this is more likely the case. Now, in more funky cases, if you have really small cells, but your RBCs can be normal or elevated, and your RDW is completely normal, this is more likely going to be thalassemia, a thalassemia trait. Classic thalassemia trait is really small red blood cells with a normal to high red blood cell count. And then we also see funky cases of like if everything looks normal, but the red blood cell count is low, this is either from blood loss or anemia of chronic disease. Now, if you have big red blood cells, lots of hemoglobin in them, normal concentration, red blood cell and distribution width, this could either be kind of like an early B12 folate deficiency, or this could be something like alcoholism, some sort of liver damage, or like a hypothyroidism can also do this too. So yeah, hopefully this gives you a general good overview of what things can look like. But know that all of these are kind of on a spectrum of severity. So very likely when you're in early iron deficiency, the first thing that you're going to see go down is this MCV. When you're in early B12 folate deficiency, the first thing that you're going to see up is this MCV. The hemoglobin might be impacted here as well. But in general, the first thing to change is the MCV, and these might all be normal and like gradually come out of range as the anemia starts getting worse and worse. I think one thing that I want to draw attention to is this mean corpuscular hemoglobin concentration, because this is a calculated value in the lab. So sometimes this one can look low all by itself. I wouldn't consider that to be particularly helpful clinically if this one is just low all by itself. If it's high, on the other hand, we might want to look into a blood smear as well, because if there's a very high concentration of hemoglobin in cells that look normal otherwise. This could be an indication that the cell shape is a little bit weird, like in the case of spherocytosis, where the red blood cells are like balls instead of donuts. I just scrolled through my comments and like kind of put down some of this stuff here. I'll do this in another video, but sometimes I need a little bit of a case series to kind of get my brain going, so I'll talk about these and what I think about these in the next video. Again, educational purposes only. I know this can all be kind of confusing and frustrating when the lab marks something as high or low and your doctor doesn't explain anything, but a lot of these have to be read together in context, so hopefully this series helps you understand a little bit more about what your blood tests are doing. So yeah, hope this helps.